It is January 27th, 2021. We want to welcome you in to Coronavirus Inside the Arizona Numbers. We take a closer look at the data here to help you make the best decisions for your family and your life. I'm Katie Rammel alongside Garrett Archer here to help us make sense of all these numbers. A lot of the new numbers that we've been talking about lately is the rate of vaccines that are happening here in the state of Arizona and also across the country, how fast or how slow they're rolling out. We'll talk about some of that this hour, and also we'll start where we always do, with the very latest numbers out of the state of Arizona as it pertains to both cases, hospitalizations, and I should say, and also lives lost here in Arizona. So we'll go through it all, Garrett.
Yes, today, let me see if I can get this a little closer. So in total, 738,561 is our number in Arizona. Today, they added about 6,000 cases. This seems to be about the average where we are now, anywhere from 6,000 to 7,000 cases on a given day. 5918 today. Number of new deaths, 195, still high. One of the higher ones, I think that's the top 10, number 10 ranking of deaths we've had. And then the total reported tests today, 15,601. So what does all that mean? Where we are is this is still a 7-day decrease, over 7-day week over week decrease of about 7%. So not a whole not a large decrease. A couple of weeks ago, we were at 30% decrease, or excuse me, last week. Now we're at about a 7% decrease. So it's more of a leveling off right now of the number of cases.
Garrett, I want to address something really quick because I'm seeing 500 million in the comments. I don't know if somebody said million or if I said million or you said million or somebody else heard it, but 500,000
yeah.
Vaccines, 500,000 vaccines. Yeah, Kristen's saying I may have missed something. I think we missed something too. I don't even know. 500,000 vaccines have been given out in the state of Arizona. So if that was missaid, or maybe it's in the caption. In the caption, Maria's saying. We'll get it adjusted. I think we can.
We'll get it fixed. Sorry about that.
Carrie can help on that. 500,000 vaccines given out here in the state of Arizona. The million number, we have ordered 1 million vaccines. So, okay. So, yep, the headline says it. We know we'll work on getting it fixed. We'll talk to her real quick and get it fixed on there. So anyway.
Okay,
I'm going to address whatever that was. That's never happened before in the whole year we've done this.
So yes, it is not 500 million. Thank you very much. It is absolutely not 500 million. It is a typo. They're getting it fixed. About 500,000, 500,000 vaccines have been distributed. And since we're talking about that, let's just go right over to the vaccines, shall we? We'll get back to the other numbers in a second. So let's look at the newest data for the vaccines. This is where we are right now. No more phases 1A. All of the counties are now outside of 1A, which means they're now at least everyone is in the priority 1B or phase 1B, which is the here to get the outlines here. If you're in priority 1B, it's education and childcare workers, protective service occupations, adults 65 and older, and then remaining 1A, which is the healthcare workers, healthcare support, emergency medical, long-term care facility staff and residents. And so we are no longer in 1A anywhere in the state. We are at 5,118,125 doses administered. So, but important to note something. We are at 430,673 people that have gotten their first dose and 79,000 that have their completed series. And that's a very, very important distinction because, and I know that this has been, talked about constantly, but this is a 2-series vaccine. You do not get immunity from this vaccine by taking just one dose. So while we're saying 500,000 doses, until you get that completed series, 80,000, so about 1% of Arizona have gotten their full immunity dosage right now. And we've actually had a conversation with ASU Biodesign Institute today, and that actually came up.
Yeah, what did they have to say about that?
So Dr. Joshua LeBaire, who's the director there, we were talking about vaccines today and variants. And one of the things he said is in the next couple of weeks, really, it's going to be a battle between vaccines and variants. And one of the best ways that Arizonans and pretty much anybody can basically help the vaccines win that battle is to get that second dose, because similar to a bacterial infection or anything, theoretically, he said, if you only get the one dose just primes your immunity. So if you your immune system. So if you just get the one dose and then you get infected with COVID-19 after getting that first dose, you're actually in a situation which you're contributing to a factor where the virus is in an environment now where it can respond to your immunities and your antibodies, but not, but still be infectious. So you could be helping to cause a variant strain that would lead to a variant of this disease that would be more be resistant to the vaccine.
Yeah. It's kind of like, Garrett, when they give you an antibody for something, they say take the whole series. Don't just when you feel better, you don't exhibit symptoms anymore, stop taking whatever it is and leave the jar in your house and not finish it. They want you to finish the whole thing and get your system back to normal, not create a situation where there's a variant or you're resistant to something. So
so you could have that situation, and I'm not saying, I mean, obviously there could be situations, many people won't be intentionally infecting other people. Obviously, there's no question, but that's why we're saying they're encouraging everybody to follow up with their vaccine. If they got the first vaccine, it is crucial that you get your second dose.
So here's the deal on that. I want to remind everybody something that we talked about on Friday. If you weren't here with us, they've made it a little bit easier, at least at State Farm Stadium, to get signed up for that second dose. So here's how it works. Once you get your first dose, you sit in the parking lot for the 15 minutes and they make sure that everything's okay with you. You're not having any kind of reaction and you can go on your way. They are going to set you up for your second appointment right at the pod, right at that point of distribution, so that you don't have to mess with that computer system anymore and you're already set up and you're ready to go. So that is some.
Oh, go ahead. Sorry.
I was just going to say that is something that changed on Friday when they announced this. Now, if you had your appointment beforehand and you got your shot, you're still going to be getting that email to sign you up for the second one. If you're not responding to the email, they're going to start calling you, or if you didn't leave an email address for them to contact you at, they're going to work to get in touch with you over the phone to get you signed up for that second one. So that's anybody that got their first dose before the 21st of January. Those are the changes that are happening there. So if you're going for your second or your first one today, don't worry about trying to even get signed up for your second dose. They'll do that right there at the site.
Yeah, and I want to say in some levity here, I'm with Ben Amaya saying that you should hand out free tacos while you get your vaccine.
Absolutely.
Ben, I'm with you there. Anything that shows free tacos, that offers free tacos, I'm there in a heartbeat.
Yeah, so. He's also writing, you'll have a lot of people show up. I wish that was the problem we were trying to solve. We're still having lots of people show up. It's just they can't get signed up. That's the problem. So working through those things along the way. And Connie's saying, what about Yuma? Okay, so Connie, when Arizona, when the state gets its allotment of vaccines, they're distributed based on population of the county. So it's not that some areas are getting forgotten. It's based on how many people live there and how many people are in those groups. So group 1A, group priority group 1B for most, and in Apache, La Paz, Navajo, and Santa Cruz, the number of people that would be in 1B as well, because those 4 of our 15 counties have moved on to that 1B category. So I know a lot of people are saying, wait, look at you can see the numbers right there. Wait, we only got this many in such and such county. That's why, all based on population. Okay, we're getting so many questions on vaccinations and being able to get signed up for that. What's the point if you can't even get an appointment for the well, you can get an appointment for the second dose, Lauren's writing. Remember, you can get the appointment for the second one when you pull through. If you're having trouble getting an appointment for the first one, we'll be announcing when they're moving to each different category. We'll be sure to let you know when we move on to fully in 1B or 1C. We're just not at that point yet. And if you're still having trouble signing up, remember, they're going to get more allotments in each week. And the Biden administration has said, we're going to give you 3 weeks notice instead of the 1 week notice that they've been getting, so that people can get signed up. So hopefully we'll have more appointments that are available that are opening soon. Okay. I think we can move on with vaccines. Yeah. And Susan's asking, when will group 1C be available? We just don't know, Susan.
I have no idea. Yeah.
It can be months, it could be weeks. We don't know at this point. Most are only in priority 1B, so we still have all of 1B to get through before we can move on to 1C.
Barbara Donovan is saying it will be different in each county, and she is perfectly correct.
Yep.
Each county will get to 1C when they get to 1C, and it will not be, statewide announcement. They're going to move at whatever pace they're at. So,
Yep. Okay, so let's get on to some of the other numbers. If we have more time for vaccination questions, we can get back to that a little bit later in this hour that we have here. But Garrett, as far as our numbers today, 738,000 here in the state of Arizona. That's our total cases. We had almost 6,000 in the case count today showing up. That does seem to be trending a little lower than we've seen in weeks past.
yes, we are trending a bit lower. Our positivity rate is under 20% for the first time since, I want to say late December at this point. We had a very high spike after Christmas in positivity rates where we were getting 25, almost 30%, but now we're at about 19%. It does continue to drop. It's dropping slowly, but still dropping. I'm pulling this data right now, so just give me 1 second so I can show you what I'm looking at. It's taking a little longer for it to get
there. Okay. That's okay.
But yes, as we talked about, let me just go with you while I'm waiting for this. I'll just give you a quick summary. The hospitalizations seem to be a little on the level right now side. Mm-hmm. They're leveling out. The case numbers continue to drop. The deaths numbers continue to increase. We did talk about that we would be this sort of window for several weeks in which death numbers would increase while case numbers were going down. And we are in that window and will likely be there for the next 12 to 14 days at this point. But otherwise, things are looking pretty good in Arizona right now as far as the numbers.
And unfortunately, though, we still are maybe one of the worst spots in the world for our COVID situation here in Arizona. So while the numbers are starting to trend down, they're in many places trending down. So we're not necessarily falling out of that top few spots in there. Yesterday, I think we had one state that was exhibiting more COVID than we were.
Yes. So, and I see, I'm going to address something in the comments here really quick. Why are there only COVID deaths? Susanna is asking, what are the COVID only deaths? Is that what you're asking, Susanna? You're asking, what are the COVID deaths only? Okay. So I believe what you're asking are, why is there a situation in which there would be death certificates that only say COVID-19 as the cause of death and nothing else? If I'm reading that wrong, please let me know. But in that case, that is, if you look at some of the documentation on the CDC regarding that, that's more of an error than anything else. It's something as the data is coming into the CDC, there are times in which a small percentage of the death certificates will only have COVID-19 marked, and they will have to go back and sort of research why these death certificates don't have another underlying cause of death in there, and then it will be filled out. So that it's about a 6% rate of that, how that occurs. As far as the actual numbers of people who died in Arizona, what we can tell you is that looking at crude death estimates from the Arizona Department of Health vital statistics, there's been about the 5-year average of deaths in Arizona is about 60,000 deaths a year. That's what we typically see. This last year, we had about 75,000 deaths. So it's about a 30% increase in deaths in 1 year from the 5-year average. So
Garrett, what I'm hearing in all this, though, is that when it says 6% and they're seeing that, that's somebody pulling those numbers out and thinking it means something else than it actually does. What they're thinking is, oh, these are the only true COVID deaths. Correct. And what this is saying is that is not necessarily the case. It's just that the other modes of death need to be filled in on the top of that chart. So it's actually more of a administrative thing that's going on.
Exactly. There's not, it's like they're looking at it in the wrong way. So they're seeing the fact that the COVID-19 is the only thing on there. They're saying, see, those are the only COVID-19 deaths. All of these others are heart attacks or brain aneurysms or whatever. But when we talk to medical doctors about this, you think about it, you don't see a death certificate that just says gunshot wound. There's always going to be something about some sort of cardiovascular situation. I forget the medical terminologies. I'm not a doctor, so I apologize. But when your heart stops or when something happens to your brain, that's what is usually put in there as this is the cause of death. blood loss or whatever. This is why this person died. And then it goes and figuring the contributing factors as to why that is. And COVID-19 is one of them on several death certificates. But if the death certificate only says COVID-19, that is an incomplete death certificate. Just like a gunshot wound itself cannot kill you, COVID-19 cannot kill you by itself. Something else kills you. Like I said, a brain aneurysm or your heart stops or something, something happens that kills you, but it is not just COVID-19. So
I think this started though, Garrett.
Yes.
Yeah, some other medical issue. I think this started with one of those situations on the internet where things were shared and shared and shared again as, aha, these are the only numbers that are true. But that is not the case. That is more an administrative, a death certificate thing that hasn't been fully investigated or fully filled out. So
yeah, and if you read the CDC's actual, like it's right there on their website. If you actually read the data definitions, they actually come right out and say that, but people took that and twisted it around to make it like, oh, look, they're only putting COVID on 6% of these death certificates. But if you read it sort of without that mindset, you'll see that that's what that paragraph is saying. Is it saying that 6% essentially are incomplete? It's been the same way for about the entire year. There were 6% incomplete in June. But now those are complete because it's been whatever amount of time it's been. And now there's 6% incomplete from November or October or whatever, and they'll be completed as well. So basically what that means is by the end of this, when all is said and done, 2 years from now, when all of this data is really compiled and put into these annual big reports, that 6% will no longer be there because they will have gone through everything long before that.
And it's one of the reasons usually it takes 2 years to get some of these full reports out from health departments. And that's for any issue. That is not a COVID related issue. That's for anything. Kimberly also had a question just a moment ago. And she was wondering about the testing numbers. So she writes, it also looked like the numbers are going down because people aren't testing as much. So are we really looking at the numbers going down? Percentage still looks the same. So let's help her.
The number of tests aren't really going down that much. Let me go to this page here that I have up and I'll show you. You can see this graph right here is the test numbers. And as you can see, they're not really going down all that much. We're not at peak by any means for testing, but ever since basically November to now, our testing has remained fairly even throughout the entire period. And you can see all the other graphs are going around that testing graph. You can see the case numbers spike in early January. The death numbers continue to they fluctuate up and down. But all these numbers sort of are going around this testing graph, which is staying fairly level. Same thing with the positivity graph. You can see we had a spike of positivity and then it started going down. But that's agnostic to the number of PCR tests that are being taken. So just sort of know that it's not necessarily because people are testing less. We actually are getting less positivity rates. That is in fact happening. You can see that right there. Percent positivity of the 7-day rolling average is 19% right now. So, things are for the most part looking better.
Yeah, it's interesting. I'm finding it seems like anecdotally, at least, different people are testing because as some people are heading back to the workplace and other things, they're saying, okay, you've got to get tested or you have to get tested before you do whatever that thing is. And so people who are headed in to then get tested have never been tested before. So those repeat numbers versus somebody who's brand new to the testing positive to testing at all are sort of interesting too in all of this.
Yeah, that's actually a good point. We don't come to that very often. So let me go to that really quick. Talking about the testing versus those who are new tests and those who are, have been tested, from multiple times. So we'll go to the laboratory testing graph on the AZDHS website. You can see that about 3.8 million Arizonans, so essentially half of Arizona, has had a test for COVID-19 at this point.
And that is not repeat testers. That is just raw.
No, it's not repeat. Oh, you know what? Let me get you the actual number because the serology doesn't play a big part, but it still changes the number. So this is the diagnostic test. 3.4 million Arizonans have gotten a test for COVID-19 at about a positivity rate of about 15% over the course of the entire pandemic. Today, 15,600 new people got tested. So why am I saying this? People tested because now we go to test conducted and you can see a very different story. About double the number, 6.5 million tests have been conducted in Arizona. 42,000 just today. And this is going to account for long-term care facility. People have been tested multiple times. I've been tested multiple times. I know, Katie, you've been tested multiple times. People who are medical doctors obviously get tested multiple times. So this is accounting for that number. So we've actually conducted a lot more tests in Arizona than what was previously published. But we do have this breakout now, which is very appreciative by us who do this data analysis, to know that, for the longest time it was told Arizona has the lowest testing rate, but we were also being compared against other states that were not giving just people tested. They were giving all tests. And so now you can see that our testing number isn't as bad as we thought it was back in September. So, don't get me wrong. It was still pretty bad in early summer and early spring, but it's gotten much better since when they bought that equipment. It's at was it SonoraQuest, and we're able to actually make these numbers, and we don't have a test lag anymore.
Yeah, it's interesting too. There's something on this page I don't think that we've talked about before, and that is the age group of the people getting tested. So look how many under 20 years old, 600,000 tests for that age group. Obviously, the bulk of the population who are essential workers, who are showing up every day, still having to be physically in the workplace from ages 20 to 44, 1.3 million diagnostic tests in that age group.
And you can see that number really change when you get to, you can see that 20 to 44, that essential workers, they more than double the number of tests that they take. So this group has, taken a lot of duplicate tests, whereas for every other age group, you can see not so much, 600 to 1,000. So it's not a double. It's not a doubling. It's still a good amount, but it's nowhere near where that 20 to 44, where it's more than double.
Yeah, just really fascinating reflection of likely our workforce and those out in the field right now as well. Okay, so I saw a question about antibody tests from Debbie. Do test totals include antibody tests? That's part of that pull down bar right there.
Yeah, we have serology tests. The test totals that I give do not include antibody tests because we keep them separate. So this is the antibody test. You can see I don't even know what to really make of these numbers too much, because to me, as an analyst, it has not been explained to me that this is a random sampling of Arizonans. So when we see these numbers, I don't really take too much stock in them as far as, you see the numbers of positivity rates for antibodies here. So who has positive antibodies? We're at 24%. Let's see where we are right now. 19% or so for this last week, but that says 9.7%. So what this is basically saying is that if this 414,000 were a random sample of Arizonans, then Arizona would have about a 10% antibody rate for the virus. And while it is likely close to that, it's since we don't know if this is a representative sample, we don't know. I mean, it might be close. It might be much higher. It could be as high as 25, 30%. We just don't know. So it's one of those things where it's kind of hard to tell, with antibodies and who is required to get them. And because I would presume that mostly healthcare and long-term care facilities, as you can see, the less than 20, almost nobody in that.
Yeah.
And I know you've talked about it before, how like when the kids can't even get their blood draw, that under 18. So that might just be 19 to 20 essentially.
Yeah, well, I have taken an antibody test just because I had some weird health anomalies, and I'm like, could this have ever been? So let's just go test and see. And so I've had both the saliva test done to find out if I had any active infection, but then also taking that antibody test to see if was there anything in the past that maybe I didn't know about. So just to remind everybody, the antibody test is the blood draw in this case. You would have to go to the lab setting. You couldn't go to one of these drive-up facilities necessarily and get your answer in 15 minutes. So those are the things to consider with that. That's where you can find that information. I'm not sure what more. I think it was Deborah or Debbie who had asked that. Debbie, what more you needed from that chart, but you can find that on AZDHS's site if there were other numbers that you needed from there for any personal analysis before you make choices and decisions for your family and your life. But that's where you can find that right there. Becky's asking, would you get a positive antibody test after the vaccine? There is no active coronavirus in the vaccine. But if you're making antibodies,
right. Your antibodies should be positive. That's actually a great
yeah,
question,
that is a
Becky.
good question.
I don't know the answer to that, but I'm gonna find that out, because my understanding is I would presume that the answer would be yes. But I don't know. I don't know if maybe it gives a different antibody signature. I just have no idea. So
Yeah, really fascinating question. But just to stress, there is no live coronavirus in the vaccine. That's
correct.
a
There is
question
no, yes.
we get often related to that. So Becky,
Yes.
thank you for that
It is
question.
it is not an inoculation.
Okay, let's see. We have a few more things to get through. We're just busting through all these questions so fast that we're not getting to all of the data that we want to share with you today. Not much change in those large milestone numbers, if you will, that we hit this week. Global cases at 100 million, US cases at 25 million. So we're 25% of the world's COVID cases. We're only 4% of the world's population. So you can kind of see how different those numbers align for all of that. Garrett, though, when we're looking at these numbers across the world, comparing them to the state of Arizona and also our most populous county of Maricopa County, to put all of that in perspective, we also want to look at some of these hospitalization numbers. The good news is we are starting to trend down in a few of those categories. We hope that soon means that our healthcare and our frontline workers are getting a chance to take a breath in all of this, because they've been working so hard to keep so many people safe. But how are those numbers looking right now?
So just to go through it, yes. So as far as the states of the United States, Arizona is still the sort of the top infection area of the United States. I was just looking at 91 DVOC. We'll go through the hospitalizations in just 2 seconds, but I'll just show this really quick. Here we are, where Arizona's right here, followed by South Carolina, followed by Rhode Island. So there was a time, you can see very, very briefly, where Rhode Island had a higher infection rate than us, but we're back at the top. But still trending down, obviously, no question. And then just to look at where we are as far as the the normalized by population, I'm going to put Arizona up here. You can see second in the world right now. Portugal does have a higher rate than we do by a pretty decent amount, 120 to 92. And this is, of course, if you can read that, it says 92 average new confirmed cases per 100,000 people per day over the past 7 days. So that's what that metric is. And you can see we've gone down. You can see the U.S. in fact has had a pretty precipitous decline since 14 days ago. Pretty much the most aggressive decline that we've recorded so far in the country.
Yeah.
Yeah, sorry. You wanted to go to hospitalizations now, right?
Okay. That's okay. As you pull them up, I'll answer Betsy's question. As you're starting to pull those up, where can I get a vaccine in Phoenix? I'm almost 70 years old. So really, there's only 2 sites if you're as young as 70. If you were 75, it would be pretty much open to you everywhere. But because you're in Phoenix and you are not yet 75, the only 2 locations are at State Farm Stadium and Phoenix Municipal Stadium, both which are filled with their appointments right now. You can check on there, pack your patience when you do, on their website. That is pod.vaccine.acdhs. I'm gonna have to look at the full address there for you, Betsy. But basically, there's only 2 places, because you're so young, that they can get you in at this point. In the next group, you'll be able to find a few more places, but at this point, it's just Phoenix Municipal Stadium and State Farm Stadium, based on when there's a cancellation or based on when they add some more vaccines in. So those are the 2 places. Every other place you're going to find is 75 and older. So if you have friends or family that are 75 and older, they can go sign up at any of the locations here. So there it is, .gov. Yeah, and I should have known. Podvaccine.acdhs.gov. Again, pack your patience, because most of those are filled right now. Okay, hospitalizations. We keep putting it off to answer more questions, but we're happy to answer those questions. So keep them coming. In the meantime, it is a little bit of a better story in our hospitalization numbers.
Yes, absolutely. It is, but it's an interesting story, because as you can see, just based on the graph itself, there's a leveling out going on right now. Not necessarily going down right now. We're still 30% off of our peak, which happened about 14 days ago. But still, we're about where we were at the end of December. However, for the past 2 or 3 days, there really has been little change in the numbers. And that has gone pretty much throughout most of the chart here. That was this is where we are for inpatient at 4,250. For ventilators, you can see a leveling out in ventilators too at about 686. ICU beds leveled out at about 1,024. Discharge has gone way down for the last 2 days at about 752. And that could be deaths, just so everyone knows. Discharge, we talk about this. Discharge doesn't mean you recovered from the hospital. It just means that a bed has been removed or has been freed up. So it could be a free up from a death, just to be, completely honest with everybody. Emergency room, this is one that looks pretty good so far. You can see a very precipitous decline in emergency room numbers. Now, this one does move up and down frequently. So we really want to just look at the overall trend in emergency department COVID-19 visits. And this one you can see is far down from its peak on 12/29 at 2340. We're now at 1922. So about 300 less on yesterday from the peak. And then intubations are up again. And this is one I like to, I want to say I watch this one right now pretty frequently, because I think that when we see this go up, we're looking at another couple days of heavier deaths. We have to see this number go down before our death number is going to go down. So this is a concerning number that we intubated a lot of people yesterday, because as we know, about 60% of people that are intubated, 40 to 60%. I'm going to give a very wide range because we don't know based on the region and what the hospitalizations look like, but it's about 40-60% of people who get intubated are not going to make it from the virus. So very concerning to see that number up. Hopefully it goes down quickly.
It's such a sad statistic, that last number, that how many people don't make it through that intubation process. I would, it's, you try to have hope when you see people heading into that situation, but how fragile it is when they have to be intubated, and how that situation becomes. So we're thinking of all those families as we discuss that as well. So really the families that have made it through that, boy, what a story of survival in all of this. Mm-hmm. Okay, so we talked yesterday about 200 million more doses of the vaccine being ordered throughout the U.S. so that the current numbers would be bumped up to 600 million doses ordered. That would be 300 million Americans being able to be vaccinated by the end of summer. That is the current target that is set, the hope that is set out there. So how many does that then mean for Arizona? We kind of talked about sending those out by population. So you look at our state's population of over 7 million, and you split up those doses that have been ordered, and you can kind of do the math on how many we expect to receive here. 84,000, I believe, is in the next batch for this week. Someone was asking how many are on their way. It'll be even better when we can know 3 weeks out, but 84,000 looks to be the number that they're expecting here in Arizona next. Part of that is the pharmacy partnership as well, so that's going to go to several different sites. That doesn't mean 84,000 just going to State Farm Stadium, so keep that in mind. So Laura, yeah, hopefully that answers your question. When are we getting more vaccines? Week after week after week. But
I would say, Laura, that as far as more vaccines, we're already behind in schedule. Really, in talking to people, we are supposed to be sort of what group are we in, Katie? Are the news
here? Yeah. I don't know in the building versus out of the building, but those of us who are here and are have to leave the house to work, that is 1B.
Okay, so you're at 1B. So you were told somewhere in the middle of February that Maricopa would be at 1B and not Priority 1B, right?
Well, here's what happened. Priority was added in. So when we added in that group of over 65, that sort of changed our place on the schedule. Obviously, I am more than thrilled to give anybody 65 plus my vaccine and let them go first and be behind them. So it is for a good reason, but it did definitely change our sort of mindset here. Obviously, my mask is buried in all my papers here. Here it is. We are masked at work, and when you're not seeing us on the air, we have a pretty strict protocol here in the building, and there's very few people. As you can see, this is normally a packed newsroom behind me here, and not much. Garrett, your desk would be just one over next to me here, so your desk.
And I can attest to the strictness of the protocol there. I haven't been there in 2 months, but I can attest. Yes.
Yeah. So you understand part of it being on the other side. So, when we first heard that we had applied and could be in Group 1B, considered essential workers, and then in Group 1B to be a part of that, it was exciting to hear, because we thought, oh gosh, we're up next after 1A. And then when they made the Priority 1B and those 65 and older being bumped up, again, obviously so important and for absolute good reason, but that does change our schedule a little bit. So it'll be interesting if back in March.
Yeah.
Could be.
Yeah, it
Could
could
be
be
at
marked
this.
down. So yeah, that's there's a reasonable assertion that we could be sort of, because they kind of change things around, that, what is the schedule? The schedule, of course, is a bit subjective, but we could be sort of quote unquote behind the schedule at this point.
Yeah. So Kim's writing in, our assisted living is still waiting for the vaccine. We've heard that from a lot of places. So exactly what Kim is saying. Kim, your site is not alone. I want to pull the exact numbers here. I have 2,000 sites that are signed up to get their shots and be part of this. For perspective, 140 in Arizona have already gotten the vaccine. So that just shows how far we have to go. There's been a little bit of stress and strain, if you will, between these two parties, that being the long-term care facilities getting their shots on time, and then they're seeing, car after car go through at State Farm Stadium. So it is something to discuss, and it is something to consider when you're thinking about these things. But it's kind of like what we talked about yesterday, Garrett. Do they want just the vaccine out as fast as possible, or to those highest groups of concern, but then possibly have more waste in that process, because you wouldn't open a pack and then have some left over?
Yeah,
that would inevitably
exactly. That's the biggest problem with these vaccines, especially the Pfizer vaccine, is that once they open it and once they get it ready, they got to use whatever they have. And we talked about this yesterday, how, if they've got a site open at, just say a clinic or something, or a hospital, and they have X amount of vaccines, and Y comes in to get the vaccine, but it's a smaller number than X, then they have to make up that difference, or they throw those away. So that could mean just basically going out into the parking lot and saying, hey, do you want a vaccine? This is completely legitimate, but we're either going to throw this away, or you're going to get a vaccine. So there are instances in which that can happen. I have heard of that happening in California. So
yeah. Kathy writes, but transplant recipients are 1C and wait behind the media. So Kathy, absolutely good point. And that could all change. Remember, it's not just media, but anybody who is out working in the field right now. So it is a large group of essential workers. That could be like AC unit repair people. It could be anything. So in that is valid and absolutely worth discussion. And it could mean that the list changes. That's why a lot of people don't get their hopes up on what point they're going to get through to get a vaccine, because everything can change, and that's just fine. Yeah, she says, no offense. No offense taken, Kathy. You're so sweet to say that. No offense taken at all. And I would rather have somebody who was a transplant go ahead of me. I feel like my family, we are locked down tight. My kids have not been at school. Yes, I go to work. Yes, I take a risk when I take my mask off in here. I do that to continue to provide information to the public and find that it's necessary. But I would gladly give mine to someone else to put people ahead. So
yeah, see, Jennifer is saying that, and we've heard this a lot. I've had two friends who drove their elderly parents to State Farm, and they both got the vaccine too, because they didn't want to waste it. And that does, if you are someone who's driving and you're in the car with someone who is eligible for the vaccine, there is a good chance. I think they say that we don't want to say that it's going to happen, but there's a good chance that they'll be able to vaccinate you there as well.
Yeah. We were hearing the plus ones were happening a lot more often. We're also now hearing, though, if they're getting close to having to just give it out to any plus one, that they'll transfer it over to another site within that window of time that they have it open, so that it's really going to the people who are most needing it. Yeah, Kathy's also saying we've been locked down since March. Same, Kathy. I so appreciate that you're taking this seriously too. It's a commitment that my family's made, and I appreciate that you are too. So hopefully you guys continue to stay safe as well. Okay, so we just have a matter of minutes left, and thank you all for all your comments and this order, this list. We've seen the MAD priority 1B in. It won't be unexpected if the list changes a little bit. So your voice is important. So continue to send your concerns to the health department if that's something that you want to see happen, because I think that helps. So we love you too, Kathy. Glad you guys are safe. That's what's most important. Okay, Garrett, last few minutes to get to some of these other items that we didn't get a chance to make it through today. I know people want to look forward to the future, and when we're seeing these downhill slopes, does that then mean that our modeling also seems to reflect that? I know that we've got to get through a real tough month here, and that there's going to be a lot of loss of life and a lot of sadness too, more than just these 12,000 families that we've seen here in Arizona, but more than that, because this is the last peak that we have to get through. So I remind everybody, we get through the peak of cases, we get through the peak of hospitalizations, and hopefully we're almost there on that one. And then sadly, lastly, and arguably the hardest one, getting through this peak of death and this
Yeah,
great loss. So
that of course is a true statement. As long as a variant that is vaccine resistant does not
doesn't show up.
show,
Not good. Good one.
I know, I'm sorry, but like
I know. We got to talk.
You're likely correct, because we don't have as many we don't have any community things going on, no holidays. That should be the stack of holidays that are going to cause the numbers to go up. But yeah, I mean, we've got vaccinations going on, but if a strain shows up that is vaccine resistant, then obviously that's
no, I appreciate you talking about it. I mean, that's one of the things that should be everywhere in life. We got to be able to talk about these things to educate and understand what's headed our way, and understand the possibilities, not to create fear, but to remember that these things are possible.
I wish that wasn't a true statement.
I know, same.
So, okay, so I've got the IHME model up. The ASU Biodesign did say that they're going to have a new model up in the next few days. So we're just going to use IHME until we have one from them. You can see that, yes, Super Bowl, Stephanie, you're not wrong. Who knows what Super Bowl is going to bring? We'll see when it happens. And we'll find out about 2 weeks after Super Bowl if it had any implications on the numbers. We're at January 27th here. Let's start with the numbers for our current projections. Right now, they project about 18,600 deaths for Arizona going to May 1st. But you can see, as far as the number of deaths, it's expecting a pretty significant drop-off on February 12th. Around that time is when they think that our numbers are going to start dropping off on the daily number of deaths until they get to, in that single-digit range in May. Hospitalization resources, you can see it does believe that we are on a slow decline that will, again, around February 7th or so a little earlier than deaths, start to begin a faster decline. That's what this model says. And then daily infections, it does believe we're already past the hump on those massive jump of that you can see this massive sort of from 11,000 to 9,000, and now it believes we're at about 8,000. And this doesn't mean anything to do with confirmed tests. This is just estimated infections across Arizona every day, so about 8,400 or so. And it believes that this is going to continue down till about 498 when you get into April. So that's where we are as far as our modeling is concerned. For the most part, it thinks that we are on the lower end of it. It agrees with you right now until the modeling detects a variant that is either vaccine resistant or spreads faster. Then these numbers are likely going to hold. They've been very good in the last few months. We talked about it. I say this every once in a while.
Good meaning accurate, Garrett? Is that what you mean? Yeah. Okay.
Thank you.
No
back in April, May, the IHME University of Washington model, because there wasn't a lot of data associated with COVID at that time, it was very wild. The situations were pretty much enormous. They're no longer enormous. As you can see, I'll just show you really quick what I'm talking about before we end up here. Just as a example, I'm going to add back in deaths, rapid vaccine rollout to the projections here. And you can see that the estimates that this makes on what the vaccine would do to impact the numbers is extremely minimal and doesn't really even take into account until about March 15th. And then really is extremely minimal again around April. So at this point, the model is very conservative in its estimates as far as the different variations, the different mitigation strategies. And so it's been a pretty good indicator of what's going on. So just in summary, as you said, it believes things are going down right now. Until it detects something that would change that, it's going to continue on this trajectory of a downward trend.
Yeah, we certainly hope that stays the case. Okay, so and thanks to all of you. So many of you are saying thank you in the comments. That means everything. We just have been committed to keeping you updated on this information and letting you know what's going on in our state so that you can make the best decisions. We know that the data can be overwhelming and it's so easy to misinterpret it. And that's why we're just here to help you better understand this. And I'm so thankful to our bosses for bringing Garrett on, obviously for different reasons. You were brought onto our team before COVID ever even began, but we're so grateful that you've been able to pivot and help us understand these numbers as well. So I want to remind everybody where to find all of us when we're not here with you. We will not be here with you tomorrow. I'm on assignment. But you can find all of our reporting at abc15.com/coronavirus. You can also find our newscast. One's already started because we're running a little late today. So there's one going on right now. Turn on your TVs to ABC 15 and you can catch our newscast. Also at 5, 6, I'll join you for 9 over on the CW tonight, and then also back on ABC 15 at 10. So several places to catch us. And then Garrett's Twitter account, the best place to find him, off hours at Garrett_Archer. Lively discussion over there all the time. Mine is at Katie Rammel if you're a Twitter person as well. And then so many of you are here on Facebook with us, so you can join me there at facebook.com/news from Katie. I love when I see some of these names in the comments then show up over on my Facebook page, and we can keep the conversation going. So Deb writes, thanks for the positive vibes. I love getting positive news about COVID. Deb, I cannot agree with you more. This has been a long time coming. So any positive news we can find. I mean, when there were little bright spots in September and a few in October, we were there to talk about them. So we're grateful to bring those better tidbits of news, and we hope it continues to grow. So in the meantime, though, keep your mask on, stay safe out there, and we'll see you back here very soon.